In this episode, I answer a question from a manual therapist from Illinois that is having a difficult time managing the emotional ups and downs when trying to help a client that has been in chronic pain for years and has been completely screwed over by the traditional medical model and done more treatments than they can count. Welcome back to the Soft Tissue Treatment Revolution podcast, where we teach overworked manual therapists a new injury treatment system that eliminates the frustration of not getting consistent results, allowing them to cut their treatment times by at least 50% and easily double their income. If you're new to the show and you have no idea as to who I am, my name is Dr. Matt Maggio, and I got my degree in chiropractic well over 14 years ago, but I've never performed an adjustment in practice, and I focus my treatments solely on doing quality soft tissue-based work. And I believe that the best and safest treatments in the world to fix injuries and help people get out of pain are soft tissue treatments delivered by world-class manual therapists. Thanks for stopping by and checking out the show. All right, so this week's question came from Andrew. Let me pull it up. He is a massage therapist from Illinois and looks like 8 years in practice. Question was, I've been seeing a female client who has had chronic pain in their neck for the past 10 years. They've done just about every treatment there is and seen every type of doctor there is, and nothing has helped them get any long-lasting relief. I feel awful for this person because they have been completely screwed over by so many doctors and other providers, and their problem keeps getting worse. I've been treating this client for 3 months, and all of her tissues feel healthier. She is moving better. When I ask her how she's doing, she sometimes says it's the best it's ever felt. Then the next visit, the worst she has ever felt, and back and forth between the two. I have noticed the past few times when I asked her how she was doing, she said about the same and sounded quite defeated by the whole process. I have no idea what to do in this situation, as from what I am seeing and feeling in the tissues, things are improving, but the client seems to think not, which is frustrating to say the least. What am I missing in this situation, and how do I help her see she is improving and not to freak out and be so negative that her problem is never going to get better? Just a quick reminder, I really enjoy doing these Q&As. So most of the show is fully Q&A format. So any questions you might have, just submit them. And if I think my answer can help, I'll get an episode out to you. All the information to do that is in the description of the show or wherever you might be consuming this video. So let's get right into it. First is we want to understand, I talk about this a lot and I share this in a lot of my training modules, is understanding all four presentations in an injury. As manual providers, we really get like blinders on and we focus that it's mostly just a tissue issue, specifically the soft tissue, the fascia and things like that. But there's actually four presentations in the injury. One is soft tissue, and what I consider soft tissue would be the muscle, the fascia, the ligaments, and nerve entrapments. And then there's structural, which is like the bone, the cartilage, the disc, and the tendon. Next is just metabolic. Like what does their health look like? Do they eat like crap? Do they smoke? Do they drink? Are they stressed? And last is just psychosocial. Like how are they dealing with their problem? What's their mindset around it all? One really important question. I always say it's my most important question, really to help me, see if it's truly a psychosocial issue, as well as I ask them a question during my history. And I say, on a scale of 0 to 10, 0, no pain, 10, the worst you've ever felt, like where is the pain right now? And if that person's like sitting there having a conversation with me and like conversing back and forth and they tell me they're a 10, my radar goes off a little bit of like, there might be some psychosocial components here, because I know for me, if I was a 10 and I wanted that area to be cut off, I wouldn't be sitting there having a conversation. I usually like to see people anywhere from like a 3 to 8 range. Really gives me a better idea, but sometimes this can bring out a little bit of that psychosocial component where there might be a mental block in there as well. I'm not saying they don't have other problems, but that mental block might be higher as well. I do also get pissed when some of these providers, someone just messaged me the other day and said they gave up on manual therapy because people weren't getting better and now they just talk them through their problems. Like, come on. Yeah, maybe there is some validity there, but it's not everything. You just sucked at manual therapy and you're making excuses, but I digress. So there are 3 strategies that I want to share in this episode. First is less sympathy and more empathy. We hear this all the time, and all the, feel-good gurus on the internet, like be empathetic and be this and be transparent and be vulnerable, like whatever. Hate that crap. But There's a big difference. And I think a lot of times sympathy and empathy kind of get grouped together. For me, sympathy is where you feel bad for them. Like you're like, this sucks and I feel bad for them, but you're also glad it isn't you. And Andrew was kind of saying that earlier in the question. He's like, I feel really bad for them and they've been through that. Now, empathy is different. And that's the thing that you really should try to cultivate. That's a big word, cultivate, but hey, I'm a learned doctor. So what do you say? And really, for me, empathy is you understand what they're going through and you want to help. And even better, you've experienced it yourself where you've been in pain or you've had issues that have been resolved, or you've helped others through it as well. A really good way to tease out some of that empathy is asking them another question in the history. I ask a lot of questions in the history because I like to get data to get a better idea of what is really going on and get to the root cause of everything. Is after I'm done collecting all like the ins and outs, like the factual stuff, where do you feel pain, all this kind of stuff, I say, I have one last question for you, and it is my most important question. And then I always ask, is it okay if I ask? And I say, how is this problem affecting your quality of life? And you'd be amazed at how many emotional responses I've gotten where people are like, no one's ever asked them that. They've gone to all these doctors and providers and just had the boxes checked off. And I listen. I just sit there and I listen. And when I'm done, I say, you know what? I'm really sorry that you've been dealing with that for so long and been put through the ringer that is the current medical model. But one thing I can assure you is I'm here to help and you're in the right place. That's me having empathy for them. Like, I'm sorry that that happened to you. I do feel bad, but at the same time, like I've been through it with other people and I've seen other people, so I can help you on here. Next strategy is really focus on data and test. So there's two types of data that we get. First is objective. I call this the real and the rational. So in my system called the peak method, everything has measurable tests and videos and photos and measurements across the board and palpations and everything like that, because that's real data and it's truly objective. You want to stay away from as much subjective data. That's just really how they feel. And it's really more emotional. And there's so many other contributing factors to the subjective data. If you're just like, hey, how's it feeling? They could have had a bad day. They might have like stayed up all night. They might have did something stupid the day before. They might have had a fight with their spouse or their kids. So that subjective data doesn't really serve any of us. And a lot of times it gets you stuck as the provider where you're really just trying to put out symptoms instead of really getting to the function and what's going on and relying on the data. And one thing that I do teach and I've learned over the years is when somebody comes into the office, I don't say, hey, Mary, how you doing today? I say, hey, Mary, how's your neck doing today? How's your neck doing since last visit? How's your shoulder doing since last visit? We really get specific questions how the area is doing, not just how they feel, because then it can open it up. And then, we've all been there where you're like, half the time you don't even feel like you're treating them anymore. You're like their therapist or their counselor. And I know that's important in some aspects of the treatment, but when they're in chronic pain, you want to get down to it. You want to get in there and get things moving better, get things functioning better, and put it in a much better place. Just a quick pause for an ad break to talk about our free training programs. Are you frustrated with not getting consistent results for your clients who are injured and in pain? Are you on the verge of burnout and feel like you're just stuck going through the motions in practice? Are you ready to try something new that eliminates the frustration of not getting consistent results and allows you to cut your treatment times by at least 50%? Then click the link in the show notes or wherever you're seeing this to get full access to our advanced neck and shoulder training course and also get 8 CEU credits for free with no strings attached. All the information to do that is wherever you're consuming this video. Now back to the show. All right, so the last strategy, what to do as the provider. First is be the provider that tells them what they need to hear instead of what they want to hear. Sometimes you just got to be real with these people and tell them exactly what's going on, where they're at, what their current health looks like, because so many other people will just, fluff them and be like, oh, it's not that bad. Hey, if you got someone that's 100 pounds overweight and they're complaining about constant neck pain or shoulder pain, it's like, hey, man, you're fat. You don't have to say it as mean as I do, but like, hey, you're fat. Like, you got to lose some weight. You got to participate in this. Like, you have to, this is the reality of what's going on. Or like, hey, you got some damage in your cartilage and you got all this adhesion and these nerves are stuck. You can't lift like a jackass every single day of the week and expect to get better. Or like, you can't sit at the computer for 27 out of 24 hours a day because you're not going to get any better. Be the person, the provider that tells them the truth, because everyone else is lying to them and that's not why they're any better. And then they fall for gimmicks and quick tricks and all sorts of stuff. Next is just be the leader. They came to you for a reason because you have a problem, not a problem. You have skills that can solve their problem. They want you to be the leader and you need to be definitive about what you do. Tell them what to do in between treatment. Tell them what to do for scheduling. Tell them how to get this going in the right direction. A lot of clients come in and they say, here's my problem, you take care of it. It's like, no, I'm going to help you and I'm going to show you the way, but you got to participate. Next is hold them accountable. Hold them accountable to the treatment. The best way that I've seen to do that, and I teach everyone to do that, is get them to pay for multiple treatments upfront and get committed in there. Because if people are committed with the pricing and paying in advance, it's going to allow it to see all the way through. Because with chronic pain people, there's going to be ups and downs where they're going to have some good days, they're going to have some bad days. But as long as the tests and measurements and function continues to improve, they're making really good progress. But if you're just trying to do a visit by visit, that really gets you stuck more in that subjective data where they're always like, hey, how do you feel? I hope they feel better. I don't know. And then maybe they feel better. And this is what was happening in this situation. Like one day they're like, this is the best I've ever felt. Oh, I feel awful again. It's just like a roller coaster. Paying in advance and having them commit to the process really allows you to keep on that steady train and keep it moving in the right direction. And lastly is just don't let them be a victim. We live in a world of victimhood where everyone wants to be a label or their diagnosis. They're like, oh, I have degenerative disc disease. There's nothing I can do. I've seen all the doctors. There's nothing I can do. And I'm like, is that how you want to be? Is that really where you want to be? Just like giving up and going from there? Like, give them hope, but also let them know they have to participate in the care. They can't be passive, and you're going to see it all the way through and solve their problem. That's all I got for the episode. As I close every episode each week, go out there and be great this week. The world needs access to your amazing treatments so they can stay the hell away from the traditional medical model of pain pills, injections, and surgeries that only make things worse and definitely ruin people's lives. I appreciate you watching or listening, and I will catch you on the next one.